Hello again, Professor Mihaltan. It's nice to speak about sleep field and about sleep field in Romania, because I know that it was very hard to develop this specialty here. You started after some internship across the border, some internship in France and Germany, if I remember well. And actually you start to work in sleep medicine when here nobody heard about this field, and there was no technology, no nothing. How hard it was to develop sleep medicine in a country who has not yet reimbursement of treatment of obstructive sleep apnea.
In 2006, when I came back from my last trainings in France and Germany, I was surprised to find a very anonymous situation where only the nose air specialists are making surgery without any investigation before and without any surveillance. And of course, it was not so evident any awareness on this disease. I tried to make a voluntary work to make more common and to promote this type of sleep disorders. I was in many clinics and I made some presentations. The second thing, very important, I published a chapter in the internal medicine book for internal specialists, and after another book separately speaking only about sleep disorders. But this was not enough, of course, because we had a major pressure from raising prevalence of patients knowing now more about these diseases, and that's why we prepared the competency of sleep. It was a two-stage competency, and after we tried to have staff of trainers preparing all these new candidates for having a competency in sleep.
When did you start it with this sleep competency? After how many years? You started in 2006, let's say like that?
Yes, it was after 10 years.
Almost 10 years.
Almost 10 years.
2013.
Yes, and after more 15 years we started also the non-invasive ventilation competency. And
approved by Ministry of Health, so
yes.
It is a kind of recognition of this specialty.
We had to cross some administrative barriers, and we obtained partially coverage from the assurance system only for investigation and not for titration and for having CPAP at home for our patients. We had also some other proposals. We established a yearly dialogue with the assurance system, with the authorities, but the steps, we made small steps, but every year it was a progression in our activities because we tried to promote this type of treating and diagnosis sleep disorders. But this was not enough. Of course, I have to repeat this message, because the next step was to have an inquiry about the prevalence of sleep disorders in children, and here we made the first national inquiry in sleep disorders in children. We published this some good years ago, 5 years, and now we are now included in another inquiry for adults based on questionnaire organized by the French Society of Pneumology, and probably the results will be published next year. Romania is now on the map, and I think it's very important to have all the prevalence data to convince our authorities that this is a disease, a group of diseases we need more to focus on this.
And also, I know that you were very active in terms of lobbying, not only to authorities and to doctors, but also lobbying for general population, raising the level of knowledge in general population. And I know that you organized a lot of press conferences, and you also participate each year for many years in activities related to World Sleep Days, and not only, but how it was your experience?
World Sleep Day is a very important event. I remember when we organized for the first time in Romania, we had room plenty of journalists, over 40. Only the politicians have these events, so many journalists, but now what I can say, there are already 10 years we organized yearly this sleep day, World Sleep Day, and it is a good experience to promote all that means measures to have a healthy sleep and to induce in our population this raising awareness about their possible implications, possible sufferings in this field. But also I have to add something important. We have some other events. I encouraged every year these events who became traditionally, and here I can speak about the summer school of somnology, somnology in school, also this pediatric somnology events, and of course the section of somnology is very active with every 2 years a big congress where the participants are not only from Romania, also from Republic of Moldavia and Bulgaria, and number is increasing steadily from 1 year to other because the interest is growing from 1 year to other.
So, concluding, in Romania you are still fighting for setting up all that it is needed for this field of
we are fighting, after my impression, on 3 directions. All to gain is war with authorities to obtain coverage 100% for all our works, not only in diagnosis but also in treatment. Second, to grow the interest from other discipline, other specialties, to send their patients for this check-in regularly of sleep disorders.
Or performing by themselves,
or
because the competency
yes.
is open to
of course,
many specialists.
There are more and more other specialties interested to obtain the competency. And the third possibility we are trying to implement is to grow the number of labs, the possibility to assist and to adapt our assisting of this patient to the growing number of demands. And this is a strategy we are doing regularly, every month, every day, with only one problem, COVID problem, which is a common problem for all the sleep labs, where we have to reorganize our activities on 2 directions: guidelines for COVID patients with sleep disorders, and second, to have protection, 100% protection for our health workers who are implicated in this type of investigation and assistance.
Thank you very much, and
Thank
I wish you good luck with all activities for the future and health. Thank you.